I'd like to call this meeting to order, the Greenfield Human Rights Commission. This is the meeting for February 13th, 2023. And I want to thank everybody for getting here. And also, I apologize for any delay of information getting to you. I'm going to do a roll call. And Becky, Craig.
Present.
Grady Verplank. Is that correct? Did I do that correctly?
Verplank.
Verplank.
But I am here, yes.
Philippe Simone is here. Mackenzie.
Here.
And Empress.
Present.
Great. We have our quorum of 5. Do we need to approve the minutes? Who was doing the minutes? Was that you, Mackenzie?
Yep, I'm doing the minutes.
Did you do them last meeting?
Yes.
Okay. So what we should do is send those out to each person so that we can approve those.
Okay.
Are there any updates from the mayor's office?
Well, first of all, thank you, Mr. Vice Chair now, and welcome to Commissioner Craig. This is her first meeting as someone who is sworn in, so welcome. And I know housing is on the agenda tonight, so I won't talk a lot about it, but MJ Adams, our Community and Economic Development Director, put together a nice snapshot of what the city is doing in terms of new housing and rehabilitating housing in Greenfield. And if Philippe hasn't shared that, I'm sure we can make that available to everyone. But
Yes,
I don't want to steal anyone's thunder, so I will say on the housing front also, we had a recent cold snap, and everyone really pulled together to make sure that everyone who needed shelter got shelter. I know our social service agencies, community groups, volunteers, the city government. On the city government side, it was everyone from the Department of in the police to the Department of Economic and Community Development to the mayor's office to the health department. So thank you to everyone who helped make sure everyone who needed shelter got shelter during that cold snap. And with that, I think that's all I have to report.
Great, thank you very much. Yeah, MJ did send us a report, which I'm going to read or at least make available online for folks during that section. So we now have the election of officers that we have to do once again, because I had not put it on the agenda last time, and we did it anyway. So what we can do, we can start with is the nominations. And I'm looking for a nomination for vice chair. I'd like to nominate Empress for vice chair.
I nominate Empress too.
Seconded by Empress. And nominations for chair.
Philippe, I would like to nominate Felipe.
Yes, Philippe is fine.
I second that.
Thank you. And are there any other officers that we need to elect? Aaron?
Secretary, I believe I would like to nominate Mackenzie.
I will second that nomination. And so Mackenzie is the secretary.
I just want to ask, did I just send the minutes to you, Philippe? And
yes.
You can, okay.
Great. So let me do the roll call voice because I completely rolled over that. For the vice chair, Empress, I would like each commissioner to vote. I vote aye.
Aye.
There's 2. Becky, how do you vote?
Aye.
Mackenzie?
Aye.
Okay, it's unanimous. And for the role of chair, I had chief in my mind. I went to Yeah, I had a chief in my mind. And I just had to get that out. All in favor?
Aye.
Aye.
Just
Aye.
raise your hand. Okay, is that everybody? And Empress, is that you as well?
Yes.
Okay, thank you. For secretary, we have Mackenzie Siraj, and I vote aye.
Aye. Empress.
Aye.
Okay, and that's unanimous. Okay. So we have an update on housing, and I listed Becky as the one who was going to start that off, but she doesn't have any more information than the rest of us. But if you do have some information that you want to share, now would be a great time to do it. Or I believe that you said you sent us some documents.
Yeah, I sent a bunch of resources around from the notes that we had talked about from last meeting. So the other people on the commission should have those other resources.
And I
as
just got them this
text.
evening too. Thanks.
Yeah, I had your email wrong. Sorry.
That's all right. Thank you. Thank you very much for compiling those. Do you have anything else you'd like to say about housing in Greenfield?
Well, I think we have some people who are involved in a bunch of housing resources that are available. And I know that that was something that you had brought up as a concern. And so maybe they can speak to some of the information about some of the resources, if that's what you're interested in finding out about.
Absolutely. And we have some guests, so why don't we let them speak first? And I'd like to call on Susan Wargaftik.
Thank you, Philippe. I appreciate it, especially since we've got a housing Greenfield meeting at 6:30, which I am the person to run that meeting. So I'll have to leave here at 6:25, if not before. What I want to do first of all is talk about what housing Greenfield is. You have information from MJ about what's happening in town. I don't need to repeat that. But what Housing Greenfield is a community advocacy organization around housing. So our effort are involved in pushing to make sure that housing happens, and that it happens in a way which is supportive, particularly on the affordable housing side, but even with the general need for housing, it makes a real difference. One of the things we've been able to do is to bring together statistics and other information that have been helpful to understanding the housing situation in not just Greenfield, but in this region. And we not only have a shortage of housing here, but because our housing costs as much to build here as it does to build in Boston, we also have a gap in general between what people here can afford to pay for rent or to buy and what the costs are to actually do so. And so part of what we really are trying to do is also work with the legislature around various parts of various bills that will make that gap smaller, that will make it possible for people to be able to live here and work here in a way which is not causing them to use enormous amounts of their income in order to do so. For those who are not familiar, the rule of thumb is that you should not be paying more than 30% of your income for housing. So we have many people in town, but 67, just so you know, 67%, 2/3 of the people who live in Greenfield would be eligible for some level of subsidy for housing if those subsidies or subsidized units were available. So we are looking at a population, when we start talking about people who live here, we are talking about a great need for affordable housing. And affordable housing can come in a number of different ways. It can come through the unit having a designation that it must be affordable, and the level of that, I'm not going to go into all the little details on that, but the level of that would depend on what the subsidy requires. And then there's also what probably people are very familiar with, which are Section 8 certificates, where the the ability to be able to use those certificates goes with the person as opposed to going with the building. And I'm happy to answer any questions about that, because this stuff gets, I've taken a crash course over the last 4 years in this stuff, and there is no way to understand this. So just so you know, housing is the most complex thing I've ever dealt with. In terms of housing Greenfield, we're looking also at local ordinances and trying to figure out what would make sense. We're in the process of doing that right now, so I don't have anything to report on that, but we are looking at ways that we might be able to be advocates around that. There are also a couple of other things that I think that the Human Rights Commission might be really helpful in helping us with. One is that we're right now in the middle of the downtown revitalization process, including a parking study that's going on. We have not had, as a community, access to the Hope Street parking lot now for pretty close to 2 years. We don't see, unless the housing study comes up that with information that there is a real lack of parking around here, and I don't see that, and they don't seem to think that that's true. Why can't we use the Hope Street lot for housing? Particularly, and the process that we really need to do is to start that as soon as we can, because there's federal money and there's state money available for affordable housing right now that may not be available in the future. There's ARPA money that the state has designated for housing that will have to be designated for a project by 2025. So we need to get on it if we're going to be able to be eligible for any of those funds. So that's one thing that I think that we could all use help for from the Human Rights Commission.
Mm-hmm.
Another thing is that we have not had, we don't know what the Greenfield Housing Authority is doing. And I think it might be worthwhile for you to bring the Greenfield Housing Authority in just to discuss what are they doing, where are things going, and where they might be able to ask for some help from you. And the third thing that I wanted to talk about is that in terms of human rights, probably even more than the cost of housing, the lack of accessible housing in this community is enormous. We just don't have very many accessible units at all, especially for people who are above the lowest income levels. The Greenfield Housing Authority does have housing that is accessible at lower income levels, but someone who, is a working person who is disabled and is looking for an apartment that will give them the ability to be able to move around effectively and be able to do whatever they need to do. It's extraordinarily difficult for them to find housing here. And it seems to me that the Disability Rights Commission and the Human Rights Commission might come together to explore that issue and see what things can be done. I might add that Kelly will talk about this, I'm sure, but the units that are being built at 60 Wells Street and the units that are also being built at Wilson's will be accessible. And there are different kinds of accessibility, and I won't go into all those details either. But the fact is that they will all be, it will be possible for people who have mobility issues to be able to get into those apartments.
Oh, that's great.
But that's a drop in the bucket, and we need to have more of that.
Absolutely.
So with that, I will stop. And if anybody has any questions about who we are, what we do, I'm happy to answer them. And I can do that for the next 9 minutes.
Great. Thank you so much, Susan. Yes, and I'm going to open the floor for any questions to Susan Wargaftig on housing.
I had a question.
Yes, Grady.
Susan, you mentioned earlier that the housing costs here to build are equivalent to that of Boston. Is there anything you could enlighten us as to why that is, or if it's anything we could address?
I don't think that as a commission you can address that. It just has to do with how much labor costs, how much building materials cost. I think the issue is really that we have to figure out a way to make the gap between what people here can afford to pay and what those costs are less. And the way we do that in general is through subsidies. So one of the things in terms of advocacy, again, is getting to, there's a new housing secretary that's supposed to be coming into existence soon. Getting to that housing secretary from the administration, or getting to our state reps and saying, we need to make sure that we have that, because it's a real difficulty.
Mhm.
Sorry
I want to
about the
thank
call.
you so much for being available and giving us such good knowledge. Any other questions? Okay, we're going to move along in the agenda. And what we have coming up next is we have another guest, Kaylee Ben Ezra, who's a director at the Hampshire Franklin Shelter and Housing from CSO. I think I got all that correct. But
Thank you.
you're an expert. And I think, Kaylee, I'd love to hear suggestions on how people can advocate for themselves and like what their income might be, what their costs might be. There's a lot, from what I understood, there's a lot more people who would qualify for rent subsidy.
Okay. Well, first, I just want to start by saying that Susan has given herself not nearly as much credit as she deserves. She has
Exactly.
really learned a lot in the last 4 years, and she has become like the like light in Greenfield, Massachusetts. So I'm super thrilled that you are doing the work that you're doing. It's made a huge difference. And I think, you know, also in terms of the knowledge of, you know, folks around us who aren't in housing programs. So my name is Kelly Ben Ezra. I work at CSO and Friends of the Homeless, but I am new to CSO and Friends of the Homeless. Prior to this position, I had run what's called the Continuum of Care at Community Action, which is a federal program that provides all of the funding for housing and support services in our region for people experiencing homelessness. And I have known Becky Craig for a very long time. She and I also used to work in housing together at the Greenfield Housing Authority and then Franklin County Regional. So, you know, we both have some experience and expertise, and Becky being on this commission is really great for all of you because she also has a lot of knowledge to share with you, and we'll be able to answer a lot of the questions that you have. I think, you know, I'm happy to answer that question also, Philippe, around the income eligibility questions. Is that what you are looking for? And then I would love to also just say, before I get to that, that Susan talked about the advocacy that's really necessary in order to, you know, work with your legislators and to sort of like get information to our state house about changes that need to happen. And there is a group of heavy hitters in Western Massachusetts at a lot of organizations, you know, all the CEOs and the, you know, executive directors of agencies that have been working really hard over the last few years during COVID to create a Western Massachusetts Housing Coalition. And that coalition has been super involved in kind of identifying what all of the housing development is in Western Mass. Right now, there is enough development in the pipeline. This is like really exciting for us to consider. It's not just Greenfield, but it is going to increase the amount of affordable housing units that exist in Western Mass. And I'm talking $497 million worth of housing development that is coming. And that is huge. I mean, this is just like an unbelievable number. It only creates, I think it's 1,410 units. So if that makes you question what it costs to build this kind of housing, as Susan is talking about, it's insane, right? And so, you know, the other thing we've been really working on the advocacy level is getting our state funders to understand what developers are looking for when they're trying to bring together the funding resources and piecemeal it into a housing project. And really, they've asked for kind of like a one-stop option that includes not only the developing fees and the the capital funds, but also includes money for support services, because there's a real need to make sure that there is supportive services included when you're talking about housing resources like this, right? Like my area of interest really is homelessness. And so we're talking about people who have sometimes really struggle to go into their own housing unit without some supports. And oftentimes if people don't have that support network in place, then, moving back into homelessness is pretty common. And so that's something that you really want to stop from happening. And a lot of developers won't even develop those projects unless there's supportive services funding included. And that is the thing that's always missing. So just for all of you to have that information, it's really important. And I will send to you, Philippe, and you can share with the rest of the commission.
Thank you.
There's I will send you the document that shows all that pipeline. First of all, like all those housing development that's coming. And then also there is very specific legislative advocacy that has been developed by that group as well. We just met with all of the Western Mass legislators last Friday and shared information with them about what we're advocating for. So I'm going to give that to you too, because I think it's important for you to have it. So
That's wonderful. Thank you so much.
You're welcome.
We're so grateful to have you in our court.
Yeah. So help me understand a little bit more what your question is about eligibility for funding resource. Is this like for
Right? I'm just looking, I think, yeah, what I'd like to be able to put out there is a phone number for someone to call, and or some kind of phone number or email address or website that someone can go to, so that we can just keep getting that message out. I think that there's a lot more people than are using rent subsidy. And so that's something that needs to get out to the mainstream in Greenfield, especially.
So I think that that's important. And I think that without having landlords willing to take subsidies, this is another place of advocacy for all
Right.
Is to do some advocating with landlords about what it means to provide housing to people with low incomes, because really there are long wait lists for the vouchers themselves. And what we see happen a lot is that people get to the top of the wait list. I'm hearing literally in the next year, it's going to be a 17-year wait list for the Section 8 vouchers. So if that tells you anything about, how many people are really in need of that kind of a resource, like you said, when you started this meeting, or maybe Susan talked about that, there's this high percentage of people, because really a Section 8 voucher is available to anybody who's up to 80% of the area median income. And so those vouchers can be a real resource to lots of us, right? Like how many of us are actually paying only 30% of our income towards our rent and living expenses? And truthfully, in Western Mass, you also have to consider transportation as part of that.
Oh gosh, yeah.
That total. And that's not the case, right? Like they don't think about that. They don't say, when they say 30% of your income towards your housing costs, they're only talking about rent and utilities. And so if you add transportation, which is a huge issue here, that just increases it. So I'm just, saying it's really any one of us could utilize those vouchers, right?
Yeah.
So it's really good to normalize that this is the kind of resource that's important for so many people. So in terms of a one-stop phone number, I'm not sure if I can give you that, because there's so many different kinds of housing resources. So the housing authorities have the housing resources that are good for people at many different sort of levels on the economic ladder. And so the housing authorities, Section 8, for example, uses a centralized wait list. And so you can apply really even online for that wait list, and then local housing authorities pull from that wait list. Or they have housing projects, or I hate that term, but programs that have housing resources like a whole bunch of apartments in one location. And those are often state in our region, they're really state funded resources. So I don't, Becky, do you have a sense of like one?
Well, I think if somebody was going to ask me about that, I would probably in Franklin County direct them to the Housing Consumer Education Center through the Franklin County Regional Housing and Redevelopment Authority. They have people who are housing counselors who can meet with people, and they have people who can help people fill out applications, tell you if you qualify, tell you all that kind of stuff. So that would be probably where I might just refer somebody. But if I was hearing more about their situation, I might actually connect them to another, maybe a smaller program where they could connect with somebody that they could work with, who they could do that over a longer term, because looking for housing is really a long game and it doesn't happen quickly with a phone call. So I would probably want to like warm hand them off to somebody like me.
Yes.
Could you provide us with those contact information? For people to.
There's also, there's a bunch of different ways that we can get you information about who to contact in what scenario.
Well, and I was
Becky
also
may.
directing that to Becky.
Oh, okay.
So I just so the last meeting that we had, I looked up a whole bunch of resources, and I guess my bigger question is sort of about the scope of the work that the Human Rights Commission is doing, and what is the purpose of gathering this data? Do we have people that are contacting us and saying they don't know where to find this information and we're referring them? Or is it just for our own interest? So that's what I'm not really kind of clear about gathering the information. Who is the information intended for?
So this information is intended for the general public, because we have noticed that in Greenfield, there are a lot of people who are eligible and have not applied for rent subsidy. And they're having problems getting homes, and some of them are homeless. So I just thought it would make sense for the Human Rights Commission to have an archive of phone numbers and resources. And for housing, that would be excellent. And we can include the list that you already got. I just got it today because I didn't receive that email earlier as intended. So we could use that as a resource that we publish or that we make available to people.
And that,
I don't know how much we can do inside this organization. We definitely have to reach outside. And but if commissioners who have a heart have those resources, then they will probably use them. Becky, were you going to say something?
Oh yeah, sorry about that. There's just some like more like kind of like a clearinghouse kind of phone numbers that I might refer somebody to, where we don't have to try to make ourselves the experts on something.
Right, exactly.
There's already people who are experts in the community.
Sure.
Like Community Action has a phone number that anybody can call and they can get referred to any program. It used to be called maybe like 20 years ago, First Call for Help. So the first place that you would call if you needed help. And that's a local place, and it's going to be a local friendly person. And that's a really great phone number to have accessible, because those are the folks that are going to know about the changes in funding, what all the nuances are. So even a lot of organizations, I think, like to compile their own lists that they have, but those lists, because of a lot of funding shifts that happen, can be very quickly obsolete, and it requires a lot of maintenance. So to me, I say, call Community Action.
That's a great recommendation. Thank you so much.
I can give you that phone number right now. The phone number is 413-475-1570. I tell people
1570. Great, thank you.
all kinds of people that number all the time. That's why I know it. I don't even know my own phone number.
Andrew, did you have a question?
I do. Just for context, I moved to Greenfield from the Western Mass north of here, which is called Vermont, and in 2019. And my partner and I property manage a property here in Greenfield that's owned by my brother who lives out of state. So I had a specific question about some of the things that you said, Keely. So I'm hearing, which is true everywhere, that there's a lack of affordable housing and also the underused resource, which is sort of questionable, of the Section 8 vouchers, since people are waiting years to get the housing anyway. So, but my question was about your statement that about supporting landlords to provide housing to people who receive Section 8 and subsidized housing. And I have a couple of decades in social services, so I'm used to providing supports for families who are regularly in that cycle of unstable housing. And I understand that landlords do all kinds of things that are illegal, but isn't it illegal to turn somebody down who has a Section 8 voucher?
That is a really great question. And you are absolutely correct that it is illegal. However, landlords who have the pick of applicants can just not say, I'm not going to give you this apartment because you have a Section 8 voucher. If somebody was to say that, then certainly that potential tenant could get some support in addressing that with that landlord. And, then I would recommend somebody was to go to community legal aid and get support in fighting that battle. But to be perfectly honest, I don't know anybody who wants to then rent from that landlord, right? Because who knows how that landlord's then going to treat them moving forward. And so I think, it's just really important, I think, as citizens in this community, that we are sharing a message of need for landlords to be willing to, right? And there is not just for Section 8 programs, but there's lots of other kinds of programs that provide housing resources and often include those support services that I talked about. So for example, the CSO, Clinical and Support Options, has a program called Low Threshold Housing. And this is a housing program that, because it's called the meaning of low threshold is basically we don't run a quarry. We're not doing those landlord references. These are all kinds of things that actually keep people from getting Section 8 vouchers, right? So they might be on that wait list for 7 years, and then they come to the top and then they get denied that opportunity to use it because they don't have maybe the best background. And there have been all kinds of reasons why that might be true. And so, people in a low threshold situation means that the program is not going to screen somebody out for things like that. And they literally pay all of the rent. There's no percentage of the person's income that's going towards it. And certainly this is for people experiencing homelessness, not for just anybody. But then there are support services in place that literally can be called in the middle of the night if something were going on in that housing situation, because we assume that maybe folks that are going into that housing circumstance might have some challenges that come down the pike. And if that landlord is left alone to manage that, sometimes that's just really, they're not all in the market to be social service providers. And so that can be a real challenge for landlords. And so it's really sort of figuring out, I think as a commission, one thing that could be really helpful is for you to learn a little bit about what those resources are and what they provide to landlords, and to help them think about what to do. And that's just one suggestion for the commission to think about.
I'm writing it down.
Just a reality of what we face when we have housing. We have the financial resources to support people in getting housed. And that's also true with the Section 8 vouchers. When people are on that wait list, for however long they're on the wait list, when they get to the top, the other thing that happens is that people will be searching for an apartment once they get that voucher, and they might lose the voucher because they can't find the appropriate unit to use it in. Maybe because it's a landlord won't, they can't find a landlord that will take it. It may be because the rent is just already too high for what that voucher will allow. And also because there's just so few units for anybody. So when we're talking about people at the lowest end of the economic ladder, it's much harder for them.
Kayla, does that mean that the vouchers are only for a specific amount, but they don't always cover the total cost of the rent?
Yes. So these are federal government vouchers, Section 8 vouchers. And so the federal government determines an amount of money for a 3-bedroom, for a 2-bedroom, for a 1-bedroom, for a 0-bedroom in any part of the country, right? Any part of, in Western Mass, there's like Franklin County, and then there's, Hampshire County, and then there's like certain other towns and cities within that area. So each one has, and each housing authority has a limit that they can go to for a 3-bedroom apartment, let's say. And so then the person who's renting can only go to that amount. And that includes both the rent and the utilities on that unit. And so some people are just totally priced out of the market to begin with those vouchers. Which is another reason why landlords say no, because they can't get as much rent.
Right.
Or as much space as they actually need for their family, which is the other issue.
Right.
And sometimes the family breakdown of what the housing authority will allow you to rent is not sufficient.
I'd simply say now that it seems like the best solution would be to knock down the prices and level the whole playing field. I don't see that happening unless it's something that is forced on property owners to do so. But I would like to urge landlords to try to be fair. You don't want to sleep outside. It's winter. Nobody else does either. So let's be fair and let's be generous and try not to chase each other, landlord against landlord, building the prices up unreasonably, because they are unreasonable and they do not reflect the property value and they do not reflect the condition of the housing at all in this area. Maybe a few very new units do, but not from what I've seen.
Yeah. So the only other thing that I would request from you all is in your role is to help our city kind of help CSO and Friends of the Homeless to find an alternate sheltering site. We are in the midst of, I don't know how many of you have heard this, but we are in the midst of, we have just about closed, maybe this coming week, closing on the Wells Street property, which is where the current shelter lives. And CSO is now going to be the provider that is providing shelter in Greenfield on Wells Street in that same location. And we are about to undergo a 2-year-long redevelopment process of that site. And that site will move from 30 beds of shelter to 40 beds of shelter. And it will have a resource center on site that will include clinical and healthcare and also food as healthcare in a way that maybe doesn't exist currently at the shelter. Those things are going to start before we're done with this 2-year redevelopment, but the site itself will then be developed in a way that provides, location for all of those resources. And in addition, we'll have 36 units, single room occupancy units. So those are 0-bedroom units for one individual that are Section 8 vouchered on site, and those vouchers will be attached to the unit. And then once somebody has been in that unit for a year, they will have the opportunity to apply for a mobile voucher and move with that voucher somewhere else, to help sort of with the continuity of movement so that we can actually have some open shelter beds eventually, because we haven't for quite some time. And there are people who are at the shelter now, who've been there for 2 years, because there's nowhere for them to go from there. So what we're going to need, though, while that whole really beautiful development happens, is to have an alternative site. And we're having a really hard time finding that. So, you know, as you can imagine, not a lot of business owners really want to run the shelter, or they don't want to have the shelter in their location that they might own. And so that is something that we might come back to you for, is to really get some advocacy on the ground, thinking about trying to find that site. So what we're looking for in terms of timing is probably next summer, or this coming summer, actually. Anywhere from like July to September, I'm thinking, is when they're going to start breaking ground.
Could you write something out, Kaylee, and send it to me?
Yep.
So that we can look at it and probably adopt a strategy.
Sure. Yep.
Does anybody else have any questions for Kaylee?
I have a question, Kaylee.
It's actually Kelly. but
Kelly.
Thank you.
Okay.
I don't always correct people, but I figured it would be helpful.
Well, nice to meet you, Kelly. I have a couple questions for you. Now, you said that this alternate shelter site that you're looking for something between this, let me see, through July, September to summer 2023 till how long?
Well, I think the goal is 12 months. I think my reality is 15 before I can really assume that the shelter space is going to be complete. So what I think is probably going to happen is that we're going to complete the shelter, and then we'll hopefully get to move people in to use the shelter. And then the addition that's happening there to do the permanent housing units will probably still be under construction, but I feel like my hope is that we'll get to be back in the building within 12 to 15 months.
Okay, and how many beds did you say it was? Or how much
So
space?
we are contracted from the state starting April 1st for 40 beds. Right now, and that's of just shelter beds. Right now, the shelter on Wells Street provides 30. And so we probably are not going, I'm not going to guarantee that on April 1st, we're going to have 40 beds because we're just going to be taking over the site and have to do a lot of work to make sure that it's up and running in a way that we can add beds. And so probably not as soon as April 1st, but within a couple of months, we will have 40 beds at Wells Street. So then the goal is that in whatever alternate site we end up in, we would want to keep the 40 beds, especially for the winter next
And
year.
there's an update from MJ Adams that I sent to everybody about the Wells Street shelter as well. Any more questions for Kelly?
Yes. Yes, I wasn't finished yet. Kelly, I'm sorry.
No, it's okay.
I know you said that you've reached out to some people regarding this. Do you know how much outreach you've done?
I know, yes, I do. I know that we've contacted a few local folks that own buildings that are either empty or will be empty at some point. I think the toughest thing for us is having the money to renovate whatever space that is. Which is one of the things that we've applied for with the city of Greenfield, actually, is some CDBG funding so that we can get a little bit of extra money to help support that, because our contract with the state doesn't really cover, and neither do any of the development funds that we've applied for. They don't cover us being in an alternate site, right? It doesn't cover also renovating some other building to include showers and to have the space be appropriate to provide for sleeping, especially a lot, there's a lot of zoning laws around sleeping sites. And so, appropriately, there's like expectations around sprinkler systems and things like that. But also, you know, there's just always a bunch of things that get in the way of using a space in a certain way. So we have to be thoughtful about that too.
Okay, so what I'm gonna do is I'm gonna follow up with Philippe and see as far as your proposal and what you're looking for, and try to see what I can do to help with the project.
Awesome, thank you. I will put something together so that you guys have like talking points and things to consider in terms of space, you know, because we're probably, I mean, very conservatively, we would need 6,000 to 8,000 square feet of space to provide for sheltering and some, you know, case management services and stuff. We clearly aren't expecting to do everything on site at that location because CSO has lots of office space in the area. We can also move like some of our case management support and nursing staff and things like that into a different location and not in the same space where we're going to be sheltering people, because I assume that we just aren't going to find a space that's going to be big enough to provide all of that.
Thank you, Kelly.
Yeah, thank you very much, Kelly. Really appreciate it. Are there any other questions for Kelly?
I don't have a question for Kelly, but I want to jump on something that you said and Becky said earlier. I remember
Jump on.
My apologies.
That's okay.
But I want to back up with what I should say, back up with what you and Becky was mentioning earlier.
Mhm.
Actually, two things Becky was saying as far as is there a reason that we're putting the data together? And I know you was mentioning as far as for the community. If you remember about 5-6 months ago when Wendy was here and she did the open forum community event at John John Community Center to inform the community as far as Green River and all the situations surrounding that. Well, I was speaking to some people recently, and I have a lot of good feedback as far as if we was to put together an open forum, a citywide info session with services, landlords, and community members, and pull everybody together to basically ask these questions and get the information out there on a more generalized level, like as you were speaking about. Besides just having it online, at least we could have more of a face-to-face conversation with community members, have landlords come up and talk about their situations as well, and have like more of a, like I said, information-based question answer session where basically everybody gets together and do something like that. Obviously right now there's so much going on. Wouldn't it be a good time to plan something like that? But I think that's definitely something we should look into for 2023 as a project to take on.
I absolutely agree, and I thank you very much for bringing that up.
You're welcome. That's it from me.
Are you sure?
Yeah, that's it.
Thank you. Thank you, Empress. Does anybody else have anything to say or ask of Kelly? Okay, let's move along. I want to thank Kelly very much for being here. I see you've sent me a link, and I appreciate that.
Yeah, I just put into the link the 3 County COC website. That's the continuum of care that I used to work for. There's a lot of information about resources for housing and stuff on there. Just to start with.
Yeah, it looks like we have a lot of places to call, a lot of services that I certainly didn't know anything about. Becky brought in quite a few good community organizations and local organizations. So we've got some homework. And I'm really glad. I really like that idea, Empress. That's my comment. Shall we move along to the next subject?
Thank you for having me. I'm going to head out and go to the Housing Greenfield meeting.
Yes, thank you very much for being here. Very, very productive. Okay, so next on the agenda is the update on, update on local healthcare availability. Is Robert Baldor from Bay State Health here? I guess he is not here. But we do have a very unique and new kind of program that is coming, that is being worked on. And Jane Bergmark is here to tell us just a little bit about it. Jane, could you tell us about this program?
You bet. You bet. Hi, everyone. And I'm so happy to be here with you all and hear about these programs. I definitely would love to collaborate with Kelly and Empress and Susan on their work they're doing for the homeless here. I am from Rhode Island, and I worked with Crossroads, which is our homeless shelter in Providence, Rhode Island, teaching yoga. My background is in holistic arts. I studied Eastern medicine, and then I got a degree as an occupational therapist. I've gone on to work with the elderly and the dying, and I have a certificate as an end-of-life doula now from the University of Vermont. There's so much work to be done in our healthcare system. So, you know, we have these problems in our with housing. The same can be said for our healthcare system. There's so many people who are uninsured. There are many people who are underinsured. I'm very tired because I was up at 6 a.m. volunteering with a gentleman who has a debilitated disease, and his family has had to rally together in between his good health care, which was provided by his job when he had it, and now switching to Medicare, Medicaid. But there's so many gaps that happen for people. Another field we find is the dental care. And so I've been collaborating with a hygienist who also goes with no pay to people's homes in the area that can't get to her. You know, our hearts are really big a lot of times, like you all in the healthcare fields. And so we're finding that we have to fill the gaps for our local people. So I'd like to collaborate with you all. I'd like to see all these great organizations that you're talking about somehow come together with an updated directory for us to all connect. And we do have a site in Turner's Falls. So, but I would really like to collaborate with Greenfield, because I think, you know, the more connections we have, the more people we can serve. I think that's really all. I don't want to go on and on. I would love to, you know, continue coming to these meetings, and I appreciate your time.
Thank you, Jane. I really appreciate your time. And I also was wondering if you could expand a little bit. I think you have some people that you've been talking to who are interested in opening some kind of community health center.
Absolutely. Dr. Cohen, who is in Turner's Falls, his hygienist is studying to be a dentist, and she will most likely take over his practice. And she and I worked together on hospice cases in the past. So we will probably convert the downstairs to his dental office. We would want to make it wheelchair accessible. That's the only problem. But there's a space, and there's offices, and I have many years of volunteering and working with nonprofits. So maybe we would go the nonprofit route, but I kind of want to talk to all of you and see how we can get funding and how we can get services to people. Primarily mental health, dental health, and seniors to start. But you know, there's so many avenues we could go there. So thanks for listening. Best to everyone.
Thank you. Are there any comments about healthcare from commission members, or any questions for Jane Bergmark?
And just a comment, Philippe, I would like to hear what Bay State has to say, because we have this beautiful—
I do too, yeah.
We have a beautiful, huge facility, and it would be great if maybe that
was
could
used.
Be
yeah.
Thank you all.
I mean, I'm very interested myself in the healthcare situation, because I have to wait till the end of March before I have an appointment while my medication runs out. Anyway, it's just ridiculous, and we have to do something so that people in Greenfield have housing and healthcare. I don't think it's too much to ask.
Kelly was saying, you know, services to help people through that phase of having a house, keeping their house. There's mental health stuff that needs to be addressed there. Lastly, I've connected with people who do a grief program at Greenfield High School. I can't think of the name of it. Lifetimes grief support. So they do, I think it's 8 weeks, and they're all trained. But these people have done this for 10 years, and they want to pass the torch. So we have great people doing amazing things in this community. But we've got to keep them going, and of course get more services. So that's another area that I'd like to address is grief services for and suicide prevention for high school students and kids and veterans.
Thank you. Any questions or comments, Becky?
I just have a comment for anybody that wants to learn more about these resources. The Franklin County Resource Network meeting happens twice a month. It's a community action run organization. Anybody can go to the meeting. It lasts about 2 hours, and you'll hear about all kinds of local organizations, and you can meet people and connect with them.
Thank you.
That's fantastic. Thank you very much. Any other comments?
I think Andra has her hand raised.
Yes.
Yeah, I guess I was just wondering where data might be available for what the healthcare gaps are in Greenfield specifically. I mean, I can generalize, having the background that I do, that probably there's a lack of Medicaid providers, and probably that, but just it sounds like this group is looking for some focuses or
Some
just to
resources,
kind of
yeah.
gel around. Yeah, so I think that the data and the resources kind of need to go hand in hand, because then if there's going to be decision making, you'll want to be able to point to that.
Becky?
That's all. I'm just curious. Yeah.
Yeah, the for COG,
Franklin Regional Council of Governments. Yes.
Yes, so they've done some health studies and a CHIP. I don't know what it stands for. CHIP.
Community Health Improvement Plan.
There you go.
Yeah.
I just like speak in alphabet soup. So they're a local group of really super smart people that have a lot of this kind of data.
Thank you. Any other questions or comments? Okay, I have a little bit of new business that I wanted us to look at, and I will send you a link to the website where all of these are listed. But there are 2023 to 2024 Massachusetts Indigenous Legislative Agenda. And there are bills that are prohibiting Native mascots, establishing a statewide Indigenous Peoples Day, promoting education on Native American culture and history, and improving Indigenous educational outcomes, and protecting Native American heritage. There's, I believe that's like 5 or 6 bills that I would like us to study and see if we can endorse them, and see if we can support them, or at least get the city to support those bills. Individuals can very easily. And I will be sending each one of you a link to a website where that information exists. Unfortunately, I was going to have our state representative for Native American Affairs, I believe that's the title, Rhonda Anderson. She is en route from Maine, so she may not be able to make it in time. But that's a piece of legislation I'd like everybody to look at, and I will give you a link to that website. Mackenzie?
Yeah, I don't know if this is correct, but isn't there like at the State House in Boston, there's like a committee tasked with redesigning the state flag? I'm pretty sure.
Yeah, and if you'd like, I could find out about that too, if none of these bills apply to that. I was at the Nolan Beacon Project's social gathering. I filmed that, and that was one of the things that was mentioned is the state flag, because it was right there, right behind everybody. And so that legislation is doing something right now. I can't remember exactly what, but I will find out and send that along. Anything else? Anybody raise their hand? Okay. Is there any other new business? Is there any old business? I'd like to entertain a motion to adjourn.
I second that.
Oh, I can't make the motion. I'm just entertaining it.
I'll
So,
move to adjourn.
and then you'll second it.
And then I second it.
Okay, great. Thank you. All in favor, say aye. Aye, or raise your hand.
Aye.
Aye.
Okay, that's pretty unanimous. Thank you very much. This has been a really wonderful meeting. I think we've accomplished some things. I certainly have a lot of homework to do, and I will be in touch with you with some of those specific things that and resources that you can have. Again, thank you, everybody. And I'd like to adjourn the meeting of the Human Rights Commission from Greenfield, February 13th, 2023.